Hi, my name is Azana.
And I'm Joelle.
And we will be presenting
Familial dysautonomia.
The word familial dysautonomia originated from 1970 to 1975, this coming from Greek autonomia, autonomy.
Familial dysautonomia discovered in 1949 by Dr. Riley and Dr. Richard Day. In 1969 to 1979, which was accompanied by Arrigo and Dr. Pearson, is when they found out familial dysautonomia was a genetic disorder.
Familial dysautonomia, FD for short, also called Rayleigh-Day syndrome, is an inherited form that affects the nervous system. The nerve fibers of people born with FD don't work properly. For this reason, they have trouble feeling pain, temperature, skin pressure, and the position of their arms and legs. They can't fully experience taste. In addition, people born with FD have a hard time regulating bodily functions, a condition called dysautonomia. These functions are managed by the autonomic nervous system, the network of nerves that control such automatic functions such as breathing and sweating. In people with FD, dysautonomia can affect many vital functions. It can cause difficulties in swallowing, digestion, and passing urine. It can also interfere with the control of blood pressure, body temperature, and the production of tears to keep the eyes moist.
FD primarily affects Jews of Eastern European Ashkenazi background. It is a genetic problem that is caused by an inherited mutation or change in a gene called IKBKAP. Scientists believe that a mutation in this gene interferes with the body's ability to produce proteins necessary for nerves to develop and function normally. FD only occurs when someone inherits 2 copies of the mutated gene, one from each parent. If a child inherits only 1 copy of the mutated gene from one parent and 1 from the normal gene, the child will become a carrier of FD. Although he or she will not show symptoms of the illness, he will pass it on to his or her child without even knowing it. Doctors estimate that about 1 out of every 30 Ashkenazi Jews is a carrier of FD. This means that roughly 1 in every 3,600 children of Ashkenazi families is born with the disorder.
Symptoms of familial dysautonomia usually occur during infancy and become worse with age. These symptoms include poor sucking with difficulty swallowing, frequent lung infections caused by food and stomach juices that enter the lungs when a child chokes or vomits, ulcers on the cornea, the clear membrane that covers the colored outside part of the eye, abnormally high or low body temperature or blood pressure. And some children with FD may have repeated episodes of vomiting called automatic crises, which can occur every 15 to 20 minutes and can last for 24 hours. At one time, almost everyone with FD died during childhood. Now, because of advances in medical care, many live to adulthood.
To help confirm the diagnosis, your doctor may do histamine testing, in which a natural chemical called histamine is injected under your child's skin. Children who do not have FD will develop a small red bump called a wheal at the site of the histamine injection. Children with FD, however, do not have the same reaction. If a wheal does not develop at the histamine site, your doctor may take a sample of your child's blood and send it for genetic testing to look for the mutated IKBKAP gene. The expected duration of a child with familial dysautonomia is a lifelong problem.
FD cannot be prevented. However, through genetic testing, people of Ashkenazi heritage can find out whether they carry the mutated IKBKAP gene before they start a family. A genetic counselor can explain to a couple their risk of having a child born with FD. In addition, special screening tests for FD are available in a small number of medical centers that focus on FD research. These centers are located in the northeastern United States and Israel. If you have a close blood relative with FD, check with your doctor about the need for genetic testing before you start a family. Also talk to your doctor about the risk of having a child with FD if you and your spouse are both of Ashkenazi heritage.
There is no way to correct the gene mutation of familial dysautonomia. Treatments focuses on relieving a child's symptoms and preventing complications. These treatments include a feeding tube or surgical opening in the stomach called a gastrostomy, to improve feeding and to help prevent fluids and foods from entering the lungs, the moistening of the cornea, medicine to control vomiting, high blood pressure, and bladder functions, surgery to correct scoliosis, and counseling and physical support for the child and family. Further investigation of familial dysautonomia include
IKBKAP is an inhibitor of Capon-like polypeptide gene enhancer on B cells. It provides instructions for making a protein called IKK. It is found in a variety of cells, including brain cells.
In 1978, an FD patient gives birth in New York University. FD is inherited in an autosomal recessive manner, which is the presence of 2 copies of gene mutations at a locus, 22 pairs of autosomes, which are non-sex chromosomes.